I am here with Elvis Garcia. Elvis, thank you so much for taking a few minutes to speak with me today.
You're more welcome. Looking forward.
Elvis, could you tell us where you are and how the recent events of the pandemic have affected the structure of your life and your work?
Well, I think I'm privileged enough to live in an environment where we're kind of safe. We don't live in a very big city. I live in Cambridge, Massachusetts. I live by Harvard Square. So now actually it's pretty calm. There's all undergrad students have been sent back home. So even if you go out, you don't see anything. You don't see tourists. Normally it's crowded with people, huh? A lot of buses and students. But now it's quite quiet, so you can actually safely walk around without panicking about crossing someone else. It's very quiet, and it's good. At the same time, now we have to teach from home, which is not ideal. And although there is a lot of effort, there are a lot of efforts into how to improve the teaching experience and the learning experience online. I don't think we're still there yet. We haven't we have the technology, but maybe the way we do things have to change a bit. It's not only about now teaching online. It's not about connecting your camera now. It's can we teach differently? Can we consider semesters in a different way? Should we do things differently? It's not about now we do it physically. So now that we're at home, now we do it on a camera. It cannot be the same. It has to be, maybe we have to reframe what we understand by teaching. And so, yeah, I think there's a really interesting moment in time. So far, I think we're all learning and trying to do our best.
So can you say a little bit about the course that you're teaching currently? You spoke about the transition to online learning. Can you say something about the course?
Yeah, so we started this semester to teach a class on the impact of epidemics in the world and how design can tackle that. So basically, we are now in the midst of this viral pandemic. It was something expected by all public health practitioners. There was a lot written about and a lot of published. However, what is not very well thought or understood is the role of design on addressing epidemics. And when we talk about epidemics, we have to understand that it's not only about viral epidemics like this one of Ebola or SARS that everybody knows about now, but there are a lot of epidemics, chronic diseases that we are enduring, like heart disease, diabetes, cancers. All these are also epidemics that cause 70% of the deaths worldwide, and design has a big role to play. So that's where this class started, and now we're now transitioning to a more focus in viral because it's what we're dealing with, and I think there is a lot of interest on that, and we have to take advantage of this moment to make our voice heard and to raise awareness of actually there are things that designers can do.
Actually, well, that I think would be a great segue into the second question. And again, we're very early on, but given your particular background and your interests, I was curious about how you thought these recent events might influence the future world of architecture or the design of the future city.
Well, that's as you say, we're in the very early stages, so we never know the impact of all this and if there will be enough traction for things to change. All this. So we saw a few decades ago, maybe, how climate change started gaining traction and how we start hearing about green cities and green buildings, and all this trend started working. But it took forever until things kind of start getting into society and policy. Now we may face a new paradigm. It's like, oh, maybe epidemics is also a thing. Now we have been taking care of the health of the planet. What about the health of the inhabitants of the planet? Can we also look at that? And so we may be facing now switching paradigms and see. I don't think that there's going to be dramatic change. We have to, yes, understand that there are other realities that is not only climate what designers should focus in, but also epidemics as one more source of concern. And how this will evolve into a new field of study or discipline, that only time will tell. My experience, because I've been studying epidemics for many years and working in epidemics, is that we don't really learn a lot out of them. After the epidemic has gone, we just go next chapter and whatever it happens. The fact that epidemics are not defined, really defined in a way that we can schedule them. Like, we know climate change is happening and we have a lot of data, and we know if we keep going in this direction, we know what's going to be the impact in a few years. We can measure things. In epidemics, there's no way we can know. We assume that there will be a next epidemic, but we don't know when or where. So policy making is difficult because that's not the high priority in governments. You need a lot of money to move forward, because it's not only a designer changing how a building works, or how you need policymakers and money from institutions to buy in, and you need the governors to actually agree to master plans to change the way a city should be developed. So this is not something that a designer can do on their own. You can start loving in that direction, but it will take a while. So either now we can do things because there's a lot of interest in that, but I'm afraid that once this interest peaks, will disappear slowly once the epidemic goes by, because then our focus and policymakers' focus and government's focus will change into rebuilding the economics of the countries. And this still may be an opportunity for us, in the sense like, okay, we have seen the impact and the economic impact the epidemic has had. Can we take measures to reduce this economic impact? So then we can get some traction by policymakers to actually implement some ideas. So yeah, I'm mixed. I have mixed feelings on the potential of our role in the near future on this.
But do you have certain areas that you think are more critical for us to think about policy and design as it relates to the cities? I mean, do you have certain areas that you've identified that you believe should be priorities?
Sure. There are, to me, there are two ways to look at it. We can tackle this issue from the onset, or we can tackle this issue as a response mechanism, and designers have a role to play. If we go to the epidemic onset, that is normally in low middle income countries, this is not random. It happens because urban development and human development is pushing the limits. We're trying to get resources from forests, from areas where we're in contact with wildlife that may be virus reservoirs. By getting into these areas more and more, and while living in cramped environments, normally we're more in potential to get infected by these viral diseases. We're probably going through this a lot, but suddenly there is a virus that actually fits in our body, and that's where everything explodes. So by reducing contact with wild species, will minimize zoonotic transmission, that is called. So can we address this? Can we go to those countries or those areas and minimize the exposure to this wildlife? Well, this is something that not easy to do, basically because those countries where they are exposed more to wildlife are countries who don't have enough resources. So I don't see themselves trying to overcome those issues on their own. They cannot afford it. At the same time, those countries, most of them, they have a huge number of informal urban settlements. Those areas are the most likely to be impacted by an epidemic, and because they lack of water and sanitation conditions. And so here, as you may know, everybody has been encouraged to wash their hands a lot. But these things that may be obvious are not that obvious in many, many countries in the world. it's estimated that in the year 2030, 2 billion people will be living in informal urban settlements. By 2050, half of the population of the world might be living in informal urban settlements. If those settlements don't have water, health, and sanitation infrastructure. So when you are telling them you should be clean the areas to avoid the spread of diseases or to protect yourself, you're talking to people who cannot do anything against that. So can we as designers find ways to minimize their likelihood for them to be infected by diseases or to spread among these informal settlements like we're talking about billions of people. So we can, there is work done in some slums, try to optimize the way people get clean water. We can do some work in markets. So there are small pieces of work that we can start doing. We have to be realistic. We can just change. Oh yeah, sure. Let's avoid informal urban settlements. The fact that they exist is because there's no other way out of it. They exist because governments cannot cope with that. There are countries who don't have resources enough to build amazing cities around. So these settlements, they just pop up because the only way is how the country is dealing with those things. They don't have the capacity. So asking them to prevent that is just utopian. It's not going to happen. So can we from here start helping those areas at least to minimize the potential the potential spread of the disease or the outbreak of the disease in those areas by providing some sort of water, health, and sanitation infrastructures, maybe more in a creative way, more with new technologies, new materials, things that haven't been so much developed because, again, it's the global south. It's not in our agendas. But could we switch a bit more and start focusing more on that? There are studios that are working on that. The countries are definitely interested, and there are some NGOs that are trying to do that, but it's more anecdotal than actually factual. So we need to invest more in those areas to protect ourselves if we want to see it in a more selfish way. So if we want to be healthy, let's try to work there. So that's a way to work in the prevention of the disease. But what we do in the tackling the disease when the disease comes here, and here I mean developed countries like places like New York, where we've seen is having a huge impact of the disease. And there are many ways we can do things. We can do more urban design environment that I think is a bit, we're still far from there. I don't think, as I mentioned before, I don't think there will be enough willingness or financial muscle to change the way urban environments are to prevent for epidemics, basically because we don't know if there will be a next epidemic in the next 20 years. So it's difficult to move forward for that. If we knew there was one in 3 years from now, and the fatality rate will be 20%, for sure we'll do things, but we don't know it, and it may not happen. But so that's why I'm trying to be pragmatic. And so if it were me, if I had the power, I will look into health infrastructures. This is critical. Why? When we're being quarantined, it's not as much to prevent ourselves getting sick because we're gonna get the disease and we potentially die of the disease, as much as it is to prevent the whole health system from collapsing. If the health system collapses, we won't only die of the disease, we will die also from other diseases. And that's what we have to avoid. We have to control as much as we can the healthcare, the way we provide healthcare. How can we do that? Avoiding the collapse of the hospitals. And so for that, we have to have contingency plans beforehand. So whenever the epidemic comes, we are ready. What happened in Singapore or South Korea is that they already had epidemics in the near past. So they could actually react very fast. And they were ready for that. China was ready for that. And they reacted much faster than we did because they had experience in the past. So experience adds a huge value when we want to tackle epidemics. So in this case, having contingency plans for hospitals and health facilities will avoid a lot the situation. If we manage to have epidemic under control in the sense that we can actually address, we can treat all the patients. We can actually give a better health quality, provide better health quality, and most of them, or at least there will be a bigger ratio of cured patients in theory. The problem now is that we are not only not having enough beds for everybody, and everybody is getting there too late because there's no capacity. So even if they get you in the ICU, you're already too late, maybe. So you're more likely to die than if you were early enough in your disease so they can tackle your symptoms in advance. So by addressing the shortage of health facilities, we'll reduce mortality rate. That's definitely not basically from this disease already, but also from other diseases. So how can we do that? We can have contingency plans that address issues like, okay, we have a hospital. Well, how we can transform this in a more ICU environment? And the problem with ICUs is they're already dimensioned as standardized because there is a limit of people that can be in an ICU to be able to operate inside. But also there's a limit of square meters or a minimum of square meters that you have to have so to avoid the spread of the disease to other areas. So this is very standardized way ICU. So you cannot just divide ICUs in three pieces and put more people. No, what you have to do is look into other areas of the hospital that they will be not as required during the times of epidemic. For example, outpatient departments. People with now a mild fever from other diseases, if you have any other thing, you're not going to the hospital now, you stay at home. So all these areas are empty. Can we transform those areas into ICU-like areas? And it doesn't mean just putting a bed. Do we have wiring already in the area? Do we have pipes for oxygen in those areas? These are critical issues that may take a while to implement if you don't have the contingency plan in place. Because it's not the moment to start designing things when you are in the middle of epidemic. I've worked for many years for Doctors Without Borders on epidemics. We knew what we have to do. We have kits already prepared to launch an epidemic with tents, with hospitals. Everything is packed in huge cargos, and then we go, and in a couple of days, we have already set up a whole camp because we know what we're facing. The problem is that governments nowadays, they don't know what we're facing. They are not experienced, and maybe they don't have to be. So having contingency plans is fundamental. So we're talking about adapting existing infrastructures, hospital infrastructures, into a more ICU-like hospitals. But also we are talking about what happened with the logistics around that. What about waste management of those things? What about oxygen management of those things? You cannot just go and start looking for oxygen bottles for every bed because you don't have an oxygen system in place, because you will probably run out of bottles in the city, as it happens in Madrid daily, because they open a huge new hospital and they start putting one or two oxygen bottles in each bed. And that's not sustainable. You need to have a whole infrastructure. So it's fundamental to have these agreements with suppliers for different items that you will need. So it's not about only, let's build a new hospital, that, as we have seen examples. The Madrid one is a good example. It's a convention center, became a hospital, but it's not about starting from scratch. You have to already have pre-agreements with the owners of the environment, with suppliers, with waste managers, with oxygen suppliers, but with a lot of different suppliers, from beds to whatever, any kind of equipment. It wouldn't be real to believe that the government is going to stock all that in advance in case an epidemic happens, but you can have pre-arranged agreements with suppliers. So when everything happens, you have an agreed 6-month supply of these items, like masks, like all those things. Now you have to identify spaces to stock things when you receive all these items. So there is a lot of things to be done during the epidemic that you cannot really think about while you are in the midst of it. Or at least you have to minimize the amount of these issues that you have to think about. And one of the most interesting ones that we should think about is in building facilities that they are not ICU facilities, but actually facilities for mild cases. That would actually release the pressure on normal hospitals. So the example, the idea would be in having another, like a big facility that we can use, like a sports facility or a congress facility, where you can put beds that are moderately isolated from each other, but you don't need that much space. And you can actually, you don't need either ICU environment, you don't need high technical equipment, you just need areas where people is isolated on their own and can be monitored by nurse team. And if something changes for bad, they can actually have already a referral system to send you to the hospitals, ICU hospitals. Those facilities will avoid people being at home in a, 500 feet home, 4 people, 5 people living in the same place, and being all of them spreading the disease to each other. And that's one of the issues that now we are seeing in the US, for example. We see a lot of how low-income communities are the ones most affected by the virus. Because if you're living in your big house, you can isolate people in your house with their own bathroom, wherever even if one of your family is sick, they can be isolated. But try to isolate a 500 feet apartment in the middle of New York. So disparities are being shown even more nowadays. So, and we have to think on how the situation is and how we tackle this situation nowadays. I see this is a more reactive and more pragmatic approach than trying to think in how will be our ideal city with houses in their own bubble thing. No, to me, this is what we have. This we will have for many years. So how we can tackle this? One of the solutions would be to try to isolate those mild cases as soon as possible into huge facilities that don't require much surveillance, but just the minimum to keep spreading the disease. So I think that would be my approach, because this will release the pressure on hospitals and will allow actually people probably have more a normal life, because we know hospitals are ready to get people on board. They are not saturated as they are now.
Yeah, thank you so much for your insights, Elvis. I mean, as I listen to you speak, I'm reminded of course, the importance between the relationship between public health and design, and how the world of architecture will play a very big role. And I also am thinking about many of your comments were focused around the topic of infrastructure and networks, right? Be it within the informal settlements, which are prevalent throughout the global south, really throughout the world, or whether they be within the healthcare infrastructures that you talked about, ranging from technical infrastructures, but also physical infrastructures, and how we might rethink our hospital system so that we may be prepared for the next virus. So I'm really thankful for you having spent a few minutes of your day with me. I wish you the best of luck as you complete your coursework, and I look forward to a continued dialogue. Thanks again.
Thank you very much. It's been a pleasure for me. And hopefully we'll see some more traction in the future, and we can avoid this huge impact that we're having nowadays in the next one, because for sure there will be a next epidemic. So let's try to work all together into that.
Thank you. Thank you.